So, who to see? Your pelvic health dream team. The medical world is highly specialized, so it helps to know exactly who does what. Advocating for your pelvic health can feel a little intimidating at first. When you only have 15 minutes with a physician, it is so easy for your mind to go blank or to feel brushed off. To make sure you get the exact care you deserve, I want you to treat your next appointment like an interview. Empower yourself by remembering you are hiring this medical professional to be on your team. Midlife in Motion is the podcast for women who want to reclaim their metabolism, maintain their mobility, and recognize their divine worth. I'm your host, Angie Collingwood, fitness and yoga instructor, body confidence, and menopause coach. This show bridges the gap between science and soul. We move beyond quick fixes to discuss the real pillars of longevity. Get ready to start dancing into midlife. Welcome back to part 2 of our series on pelvic floor health and bladder leakage. This is the silent struggle part 2, how to actually stop the leaks. If you missed last week's episode, go back and listen. We talked about the hidden triggers of leaking, like your foot mobility, your rib cage position, and the stress you are carrying in your nervous system. Today, we are strictly focusing on the solutions for reclaiming control. I'm going to give you strategies for releasing pelvic floor tension, 4 evidence-based techniques to stop the leaks, and teach you exactly how to advocate for yourself at the doctor's office. The shifting architecture of midlife, understanding the science so that we can understand our bodies and find compassion for ourselves. So let's do a quick recap of some of the causes of dysfunction that we discussed last week. First, menopause shifts the physiological landscape of the body. Declining estrogen and progesterone act directly on the tissue of the pelvic floor and gut. Reduced estrogen can accelerate collagen breakdown, reducing the elasticity of connective tissues. Declining progesterone can slow bowel movements, increasing straining. The detrusor muscle of the bladder function changes, impacting bladder control. Again, we're focusing on understanding the science so that we can have compassion on ourselves. The cumulative load. Pelvic floor dysfunction rarely has a single cause. It can be the result of cumulative load over decades involving genetics, nutrition, environmental factors, pregnancy and childbirth, occupational heavy lifting, chronic coughing, emotional stress, rib cage placement, core engagement, and joint alignment are all contributing factors. The big misconception, tight versus weak. Before we get to the exercises, we need to correct a massive misconception. If you mention bladder leakage to someone, 9 times out of 10, they will tell you to just do more Kegels. Here's the reality. Your pelvic floor is a hammock of muscles sitting at the base of your pelvis. It supports your bladder, uterus, and bowels. Yes, sometimes bladder leakage happens because that hammock is weak and overstretched. Muscle tension issues. Surprisingly, leakage is not always caused by weak muscles. It can also result from a hypertonic or overly tense pelvic floor. When muscles are chronically tight, they are unable to fully relax or contract effectively, which can lead to muscle weakness and symptoms like incontinence. Imagine holding your bicep in a tight flex all day long. If someone suddenly threw a heavy box at you, that exhausted bicep wouldn't have the strength to catch it. If your pelvic floor is tight and exhausted, it cannot reflexively clamp down during a sneeze, which is why you leak. You cannot strengthen a muscle that is already in a chronic spasm. You have to teach it to relax first. As we move into these physical techniques, I want you to make a promise to yourself. Please give yourself grace. You are asking muscles that might have been gripping, tense, or confused for years to suddenly learn a new way of moving. This is a practice, not a performance. If you can't feel the mind-muscle connection today, that is completely okay. Your only job right now is to show up, breathe, and be gentle with yourself as you relearn your body. Since we have established that a hypertonic, overly tight pelvic floor is often the hidden culprit behind leaking, we have to teach our body how to let that tension go before attempting Kegels or core exercises, practicing lengthening the muscles. Here are 5 effective yoga poses designed to physically stretch the pelvic hammock and signal to your nervous system that it is okay to relax. Hold each of these for about 1 to 2 minutes while practicing the deep 360-degree connection breath we talked about in each of these poses. Take a moment to try them now or come back and watch the YouTube version for a visual image to help you find each pose. Remember to use caution before trying anything new. You know your body's limits. Honor how your body tells you to move in this moment and make necessary modifications. First is the butterfly pose. To begin, sit on the floor, bend your knees, pull your heels toward your pelvis, and press the soles of your feet together. Clasp your hands around your feet or ankles or shins and open your legs like a book, which naturally helps rotate your hips. Sit up tall, lift your chest, and draw your shoulders back. Focus on relaxing the glutes and tailbone. You can gently bounce your knees up and down to stimulate butterfly wings and loosen tight hips. Optional. For a deeper stretch, keep your spine straight and slightly hinge forward from the hips, resting your forearms on your thighs or reaching your arms out in front of you. Gently lift your torso to release. Use your hands to guide your knees back together and extend your legs forward. To modify, if your knees are high off the ground, sit on a yoga block or a cushion to elevate your hips. This provides more space for the joint to open. Reclining butterfly is another option. Instead of sitting up, lie on your back while keeping your feet together and your knees dropped open. This is a highly restorative pose. It's very calming, grounded, seated posture that helps relax the mind and release tension. Next is supported child's pose. This is a staple in yoga for a reason. Come down to the floor, bring your big toes together, and take your knees out wide, wider than your hips. Slowly sink your hips back toward your heels and stretch your arms out long in front of you, resting your forehead on the floor or a yoga block. You can also place a block under your tailbone for extra support. By opening your knees wide, you are physically spreading the sit bones apart, which stretches the pelvic floor muscles. As you breathe in, imagine your breath traveling all the way down your spine and inflating your lower back and pelvis. Rest into this pose. Next is happy baby pose. I know this one can feel a little silly, but I love this pose. Biomechanically, it is one of the greatest pelvic floor releases in existence. Lie flat on your back, bring your knees up towards your armpits, and reach up to grab calves, ankles, or outside edges of your feet. Let your head and tailbone rest heavily on the floor, and you can gently rock side to side. Take a deep breath here. In this position, your pelvic floor is completely exposed and lengthened. Focus entirely on melting the tension in your glutes and inner thighs. Then we have the supported deep squat, the yogi squat. We rarely squat fully to the ground in our modern lives, which is why our pelvic floors get so stiff. For this stretch, grab a yoga block, small step stool, or a stack of thick books. Stand with your feet slightly wider than your hips, toes turned out, and drop your hips all the way down into a deep squat, resting your weight completely on the book or blocks. Bring your elbows inside your knees and press them gently outward. Because the block is supporting your body weight, your pelvic floor doesn't have to work to hold you up. It can finally just drop and yield. Legs up the wall pose. This is the ultimate nervous system reset. Scoot your hips up as close to a wall as you can, lie flat on your back, and extend your legs straight up the wall. Rest your hands on your belly. Pause here. This posture uses gravity to relieve the physical pressure of your internal organs resting on your pelvic floor. It also instantly shifts your nervous system from fight or flight to rest and digest. If you only have time for one stretch after a highly stressful day, let it be this one. When you incorporate these poses daily, you are not just increasing your physical mobility, you are actively draining stress from your pelvic bowl. It's a win-win. Here are 4 practical techniques to restore your pelvic floor's foundation. First, we have the 360-degree connection breath, making sure to reduce flaring the rib cage, as seen in the diagram. Let's do a deeper dive into this technique. Your pelvic floor does not work alone. It is intimately connected to your diaphragm. Think of your core like a canister. Your diaphragm is the roof, and your pelvic floor is the base. When you inhale deeply, the diaphragm moves up and down, and the pelvic floor must stretch and yield to make room. When you exhale, the diaphragm moves up, and the pelvic floor naturally recoils. We call this the connection breath, and it is the first step in any pelvic health program. The technique: sit or lie down comfortably. Place your hands on your lower rib cage. Inhale deeply through your nose, expanding your ribs outward in all directions, front, sides, and back. As you inhale, consciously visualize your pelvic floor melting, inflating and releasing downward toward the chair. Now exhale gently through your mouth. As you breathe out, think about lifting the pelvic floor slightly upward. Do this for 5 minutes a day to teach those muscles how to coordinate and relax. The corrected Kegel, the contract and release. If a pelvic floor physical therapist confirms your muscles are simply weak, you need to do Kegels, but you need to do them correctly. Most people focus entirely on the squeeze and forget the release, which just creates more tension. You also want to aim for a mind-muscle connection, using only about 30% of your maximum effort rather than clenching with extreme force. The technique: on an exhale, slowly squeeze and lift your pelvic floor muscles as if trying to stop the flow of urine, or imagine you are picking up a small marble with your pelvic floor muscles. Draw it slightly up and in. Hold that gentle contraction for 3 to 5 seconds. Now, for the most critical part. As you inhale, completely let that marble go. Ensure the muscle returns to absolute zero before you try to contract it again, relaxing for 5 seconds. Keep your inner thighs, abs, and glutes relaxed. Quality is far more important than quantity here. Cap your goal at 10 to 15 contractions 2 or 3 times a day to avoid overworking the tissue. Sitting at a stoplight is a perfect time to practice some of these exercises. Third, we have the NAC, the preemptive brace. This is a highly effective real-time strategy for stopping stress urinary incontinence. The goal is to manually engage your core system just before applying physical pressure. The technique: the moment you feel a sneeze, a cough, or a heavy lift coming on, actively squeeze and lift your pelvic floor before the event occurs. Hold that brace through the physical sneeze or jump, and then completely release it afterward. You are essentially preloading your body's shock absorbers, so the pressure doesn't force a leak. Next, we have global system strengthening. We have to look at the surrounding architecture. Your pelvic floor relies heavily on your glutes, your inner thighs, and your deep core, specifically the transverse abdominis. If these surrounding muscles are weak, your pelvic floor has to work overtime to stabilize your pelvis, leading to exhaustion and leaks. Strengthening the pelvic floor requires coordinating these muscles with your breath during full body movements. The technique: incorporate functional movements into your weekly routine, always engaging your pelvic floor on the exhale, which is the hardest part of the movement. For transverse abdominis contractions, lie on your back with your knees bent. Exhale, engaging your pelvic floor, and draw your lower abdominals in, imagining your hip bones drawing together. Glute bridges. Exhale and drive your heels into the floor to raise your hips. Squeeze your glutes and gently draw in your lower abdomen and pelvic floor. Inhale to lower and relax. The inner thigh squeeze. Place a ball or pillow between your knees. Squeeze it on an exhale to activate the adductor muscles, which help naturally turn on the pelvic floor. Squats and lunges. To build real-world endurance, practice engaging your pelvic floor on the exhale as you lower into a squat, and keep it engaged as you return to standing. Now, this takes practice, but over time, it will become more natural. General lifestyle adjustments, building internal support, protecting the pelvic floor by optimizing the gut microbiome and ensuring smooth gastric motility. Consistent movement. Regular physical activity such as walking supports general circulation and tissue health. Managing your fiber intake helps manage gut microbiome and constipation. Aim for 25 to 30 grams daily. Fiber binds to estrogen in the gut, allowing excess hormones and those already metabolized to be excreted. It also feeds beneficial gut bacteria, creating short-chain fatty acids that lower systemic inflammation. Hydration. Fiber requires water to function. Aim for 6 to 8 cups daily to moisten digestive contents and keep the GI tract and the bladder happy. Nutritional and anti-inflammatory support. Consuming extra virgin olive oil daily is recommended because its minor compounds attach to estrogen receptors throughout the body, helping tissues adapt as natural estrogen levels fluctuate. Essential micronutrients. Maintaining adequate levels of calcium and vitamin D is a vital source of the health of all smooth muscle, including the urinary bladder and reproductive tracts. Vitamin K2. This nutrient is specifically noted for its ability to reduce inflammation in smooth muscle tissues, which are present in the renal and genital systems. Avoid irritants. Limiting alcohol, ultra-processed foods, coffee, and fizzy drinks, as these can irritate the bladder and disrupt hormone signaling. It is also beneficial for pelvic comfort. By integrating these nutritional, behavioral, and medical strategies, women can proactively manage their pelvic health through midlife transition and beyond. Calling in the reinforcements. When and who to call. It is incredibly common for women to tolerate pelvic floor dysfunction for years, often because society has normalized these issues as just a standard part of aging, childbirth, or menopause. But I want you to hear this loud and clear. Just because something is common does not mean it is optimal, and it certainly does not mean you have to live with it. Functioning in chronic discomfort or constantly modifying your life to avoid an accident is simply your system asking for support. So, when is it time to call in reinforcements? You should seek professional help if your symptoms are shrinking your world or if you experience any of these specific red flags. The heaviness sensation. If you feel a dragging, heavy sensation in your pelvis, or if it literally feels like there is a bulge, this is a primary symptom of pelvic organ prolapse, in which the bladder or uterus drops from its normal position. Pain during intimacy is not something you just have to endure. It is often a glaring signal of a hypertonic or overly tight pelvic floor that may need to be professionally released. Chronic leaking. If you are leaking daily, relying on pads constantly, or leaking without any physical trigger at all, like just standing up from a chair. Interrupted lifestyle. This is a big one. If you have stopped running, lifting weights, or jumping, or anything else just because you are terrified of an accident, it is time to get help. And by the way, you do not have to wait for a massive problem to ask for help. In many European countries, every single woman is automatically prescribed a minimum of 6 sessions of pelvic floor therapy after childbirth as standard preventative care. You are allowed to go just to get a baseline. So, who to see? Your pelvic health dream team. The medical world is highly specialized, so it helps to know exactly who does what. Here is your hierarchy of experts. First, the pelvic floor physical therapist, PFPT. This is usually your best first stop. Standard doctors look for disease, but a PFPT looks for function. They have advanced training in the biomechanics of the pelvic bowl. They will do a full evaluation to tell you exactly which muscles are tight, which are weak, and how your breathing is contributing to the issue. They can give you a customized roadmap to fix it. Second, the urogynecologist. If your physical therapist determines you have a structural issue that exercise alone cannot fix, like a severe prolapse, this is the expert to see. They are medical doctors with specialized fellowship training in both the urinary tract and the female reproductive system. They can fit you for a supportive device, prescribe specific medications, or reconstructive surgery. And you have your general gynecologist. Your standard OBGYN is excellent for ruling out acute infections or structural issues like fibroids. But critically, if you are in perimenopause or menopause, an OBGYN can prescribe vaginal estrogen. The drop in estrogen during midlife causes the tissues of your urethra to thin and weaken, often leading to sudden leaking. Localized estrogen cream might reverse this. Refer to episode 18 to HRT or not for more information on the pros and cons of hormone replacement therapy. Advocating for your pelvic health can feel a little intimidating at first, but finding the right specialist will completely change the trajectory of your physical comfort and your freedom. The appointment cheat sheet, empowering questions to ask. I know that sitting on crinkly paper in a doctor's office can feel incredibly intimidating. When you only have 15 minutes with a physician, it is so easy for your mind to go blank or to feel brushed off. To make sure you get the exact care you deserve, I want you to treat your next appointment like an interview. Empower yourself by remembering you are hiring this medical professional to be on your team. Here are 4 specific empowering questions to write down in your phone or on a sticky note to take into your appointment. Question 1. Based on my symptoms, do you suspect my pelvic floor is too weak or is it actually too tight? By asking this, you're showing your doctor that you understand the mechanics of your body. It prevents them from just blindly telling you to go home and do Kegels, which we know can make a tight pelvic floor worse. Question 2. What are the most conservative non-surgical treatment options we can start with today? This ensures that you are stepping into a progressive treatment ladder. You want to start with breathing, physical therapy, and lifestyle adjustments before immediately jumping into aggressive medications or surgeries. Question 3. Can you write me a specific referral for a pelvic floor therapist? Even if your doctor is wonderful, they likely do not have the time to do a full functional movement assessment. Do not wait for them to suggest physical therapy. Ask for the referral directly. Question 4. What are the pros and cons of localized vaginal estrogen? If you are in your late 40s, 50s, or beyonds, this is a vital question. It forces the doctor to look at your systemic hormone health, not just the isolated symptom of leaking. When you walk into that office armed with these questions, you transition from being a passive patient to an active CEO of your own biology. You are not asking for a favor, you are directing your care, finding your calm. Healing is not a perfectly straight line. If you start these exercises and then have a stressful week or a bad cough and experience a leak, please do not panic. It does not mean you're back at square one. It does not mean the tools aren't working. It just means your body is human and she needs a little extra support that day. Wrap your arms around yourself, take a deep breath, and just try again tomorrow. You do not have to live your life mapping out public restrooms or avoiding the trampoline with your kids. Your biology is resilient. Give it the right signals and it will heal. Allow yourself the time to find what works best for you. Your individual needs are important. Your health matters. You have divine worth. Let's take a moment to find some calm amidst the chaos. Allow yourself this time to pause. Place a hand on your heart and take a deep breath. Feel gratitude. Give yourself a 20-second hug and thank your body for her continued strength. Embrace your inner power. Thank you for being here today. Trust yourself, honor your biology, and remember, you were born to bloom gold. See you next time. You are building a foundation for the next 40+ years of your life, brick by brick, breath by breath. You are a miracle. Treat yourself like one. If you know a woman who needs to hear this, please share this episode and remember to subscribe. I'm Angie Collingwood. Keep moving and dancing. This is Midlife in Motion. I'll see you soon.